Welcome. In this presentation, I will be discussing the development of the CHAT2App mobile application and its role in supporting caregivers of infants with congenital heart disease. Congenital heart disease refers to a variety of defects of the heart. It is one of the most common forms of birth defect, occurring in just over 60 in 10,000 births in the UK. Around 1/3 of infants will need some form of urgent surgical intervention. The highest risk for babies in this category is between their first and second surgeries. This also happens to coincide with the initial discharge from hospital. As you can imagine, this can be a very stressful time for parents. Taking a new baby home for the first time is challenging enough, but add on the additional responsibilities of managing a significant medical condition, and there is a clear need for additional support and guidance. This is where the Congenital Heart Assessment Tool, or CHAT, comes in. CHAT was developed to help parents and caregivers in decision making. It allows the quick assessment of observations. Based on these observations, a quick check against CHAT allows for a quick decision on whether everything is okay, green, if there is something that needs to be discussed with a healthcare team member, amber, or if there is an urgent medical concern that needs to be immediately addressed, red. CHAT has undergone a range of evaluations to determine its efficacy as a tool, and has shown to be effective in helping caregivers and healthcare practitioners to make appropriate care decisions. However, these evaluations did uncover some interesting challenges. So parents still remained very anxious about the whole discharge process and found it overwhelming. And there were also concerns expressed from both parents and healthcare practitioners about ensuring that observations were captured and shared effectively. The initial brief was to develop a digital version of the CHAT tool, but we wanted to explore beyond the scope of this initial decision-making tool and try to unpick some of these concerns that emerged from the use of CHAT. So we undertook a study of the existing users of the CHAT tool. The study consisted of a number of semi-structured, open-ended online video interviews. We structured the line of questioning to ensure we were able to gain a greater understanding of the challenges parents and healthcare practitioners had faced in using CHAT, and to understand their perceptions of how technology might help to alleviate that going forward. Recruiting for a study of this nature is challenging in itself. We utilised an existing network, the Congenital Cardiac Nurses Association. There are 10 specialist centres in the UK. We worked with 5 of these and recruited 9 practitioners in total. 4 parents were recruited via the Congenital Cardiac Nurses Association contact list. We interviewed both healthcare practitioners and parents separately in small groups. Each participant received a brief before the interview, so they knew what to expect and what to do if they felt uncomfortable at any time. 2 members of the research team independently undertook a reflexive thematic analysis. Findings were consolidated into a single group of themes for both parents and healthcare practitioner interviews. Themes identified from interviews with parents and caregivers fell into 3 domains: the situation and experience of the caregiver. So there was a clear theme of apprehension of taking an infant home for the first time. This was particularly true regarding the risk of forgetting to monitor or medicate as required, and also making mistakes such as writing down the wrong information or misinterpreting and making the wrong decision. There were a number of themes in the domain of perceived benefits of an application, such as being able to set reminders to avoid forgetting. But much of the discussion of the app focused around reducing uncertainty. Normalcy was a particularly strongly emerging theme. Healthcare practitioners have a wealth of experience of infants with complex congenital heart disease, and therefore have a clear idea of what normal is. Parents don't have this experience, so when posed with questions that ask if their child is behaving normally, that can often be a cause of frustration. Finally, a number of themes were identified in relation to perceived disadvantages of the application. There was some concern amongst parents that the technology might act as a barrier for some, or become a source of information overload. There was also some clear concern about the application being viewed as a replacement for access to a healthcare practitioner. Similar domains were identified from the interviews with healthcare practitioners. However, there was clearly a different perspective within those domains. In terms of situation and experience, the consensus was that decision support tools like CHAT are generally useful and are perceived as tools that help healthcare practitioners better support parents. They also saw that the application had the potential to address perceived lack of engagement with healthcare professionals in some cases. And this is interesting because it counters the perspective of parents that reported finding talking to healthcare practitioners difficult on occasion. Perceived benefits of the application were seen to focus around compliance, such as reduced risk of data loss, easier and more direct access to guidance and support materials from one source, and reminders to complete observations. But they also highlighted communication and multilingual support opportunities, perceived disadvantages related to pressures on the healthcare practitioner role. Beyond supporting the underlying chat-based decision support mechanism, monitoring support was clearly a big focus. Amongst this, the ability of the app to define normalcy was a key objective, so the application must provide some mechanism for healthcare practitioners to encapsulate their experience of what is normal into the application in a manner tailored for a particular infant. For a healthcare practitioner to do this, they need to see trends and observation data over time, and not just one-off measurements. To achieve this, the application provides interfaces tailored for the caregiver and the healthcare practitioner. So caregivers see a simple journal logging view of observation. So this allows the caregiver to focus on the most recent and immediate present. So caregivers get immediate feedback on whether an observation is a deviation from the normal through the traffic lighting system promoted by CHAT. Healthcare practitioners have a more detailed view of the data in the form of charts showing long-term trends for each observable parameter. So they also show how these values are trending in relation to the CHAT traffic light thresholds, and the healthcare practitioner can directly edit these threshold values for each parameter to set new thresholds for green, amber and red. Reminders to avoid forgetting were emphasised by both parents and healthcare practitioners, so the application uses the mobile device notification system to prompt the users for observations. There are some concerns raised about the potential for this to increase anxiety, so a number of mitigations have been made to address this. The notifications are persistent but not intrusive. They don't demand immediate response. Notifications are only raised if needed and not duplicated. And each notification has a clear and single specific purpose. And the observation schedule is tailored to that particular infant by the healthcare practitioner to ensure measurements are only prompted for as frequently as needed. When a parent or caregiver clicks on a notification or is concerned about an infant, they can record a specific observation with a form-based dialogue. So these are typically a choice between text-based descriptions, utilising radio buttons, or numerical data using touch-based scrollers. In both cases, the colour coding of the dialogue adapts based on the green, amber, red thresholds set for that parameter, so that the caregiver parent can get immediate feedback on the outcome. The application is built around the CHAT traffic light framework, so if an observation is flagged as outside of the normal range, then there are two possible outcomes based on the CHAT, an amber warning or a red emergency. In both cases, a mobile application can provide an actionable alert which takes full focus of the UI and requires the user to interact. The high value placed on communication within the healthcare team, and in particular between caregivers and healthcare practitioners, was flagged as important throughout our interviews in terms of both importance in ensuring effective treatment, but it was also clear that the application should not be seen as a replacement for this communication. There was some disparity between healthcare practitioners and caregivers, mostly associated with ensuring that timely responses were received without unduly increasing workload, and to this end, two communication modes are supported by the application. During our interviews, it was clear that asynchronous text messaging had played an important role for many parents, so our app supports text messaging embedded within the application, and this has some specific benefits. It allows a query to be raised and a response to be garnered at a convenient time for all and includes the entire healthcare team. It allows responders, whether that be parents or healthcare practitioners, the time to gather their thoughts, review the medical history and make a considered response. And it provides a persistent record of conversations for future reference. Text messaging is not always the most appropriate form of communication. Sometimes there is a more urgent need to focus on a clear and immediate clinical goal. In this case, a video call might be a good solution. However, whilst healthcare practitioners highlighted that these have been useful in the past, in urgent circumstances, they can be overwhelming in terms of workload and response expectations. To address this, our application handles video calls via requests. Key contributions across a number of areas include information management through a single digital application, allowing easy recording and retrieval of observations, information being tailored to specific roles, decision support is tailored to specific roles based around the CHAT framework, and a digital application allows some automation of the classification against the framework. Error reduction through the removal of the subjective nature of normalcy for parents by using thresholds defined by the healthcare practitioner and reminders to undertake observations, and a more nuanced approach to communication, accounting for the disparate nature of roles and differing needs and expectations of communication relating to things like response time and workload. That's the end of this presentation, so thank you very much for listening. More details about the application and about the study that we undertook can be found in our paper. Thank you.